At 5:30, to mark Mental Health Awareness Month, we're looking at the reasons why as many as 20% of police calls involve a mental health crisis.
In recent weeks, we have seen many of these calls turn deadly. And tonight, WBZ's Louisa Mulder looks at why this is happening and what's being done to prevent these tragic incidents.
Armed with some type of sword, striking, or I should say stabbing the officer in the arm.
It has felt like a violent spring.
Shots fired, Hemingway.
With multiple police-involved shootings in the headlines, a woman in Northfield, New Hampshire, and a man in Raymond, New Hampshire, both dead after confrontations with police in the same weekend. A suspected carjacker in Boston and a man with a machete in Boston also killed in police encounters. We wanted to know, are we seeing more police-involved shootings, and what's driving them?
So let's look at Massachusetts. There we go.
Our first hurdle was finding good data. The FBI collects data on police-involved shootings, but relies on individual police departments to report them. Sam Fisher at the Harvard Injury Control Research Center uses a Washington Post database of fatal police shootings, since Massachusetts does not track officer-involved shootings statewide.
61 victims in 2015 to 2024.
This graph shows fatal shootings involving police have not sharply risen or fallen in Massachusetts, with the most recent data from 2024. And data of both fatal and non-fatal police-involved shootings from the New Hampshire Attorney General's office show a similar trend through 2026. So what drives police shootings? Well, if we zoom out to the entire New England area, Harvard researchers say there's one clear variable.
States with weak gun laws have lots of guns, and that's where police get killed. Similarly, those states are the same places where police are killing.
Professor David Hemingway showed me the correlation between prevalence of guns and police killings, with more violence in states with looser gun laws.
New England, Vermont, Maine, New Hampshire. If you are a resident there, you are something like 5 times as likely next year to be killed by a police officer.
He tells us that his brother had been dealing with mental health and drug addiction problems for years.
But we also heard in our stories about suspects suffering from mental health issues before their fatal encounters with police.
He had tape, not only on cell phones, but the wall outlets.
12% of fatal police shootings in the U.S. at that time were in response to a behavioral health call.
Maybe more now than in prior years, police are coming across people who are dealing with these behavioral health issues?
Broadly speaking, the U.S. went through a deinstitutionalization period in the 70s and 80s and even into the 90s. Police are increasingly becoming frontline mental health workers.
That's not an optimal environment for any police officer. That's not why they got into this.
For Russell Conti, a retired major of the New Hampshire State Police, and now the department's mental health and wellness coordinator, the focus is on strategies that prevent police-involved violence.
It starts off with really you talking to somebody like a human being.
Tell me more about it. What happened? There was some sort of altercation between you and your wife, is my understanding?
Called crisis intervention training, it looks like just talking. But Conti says it's about building trust and a network of advocates and clinicians to help people with mental illness before, during, and after they encounter police.
We have opened ourselves up to an awareness of this, which is why CIT exists and why we're going upstream.
Louisa Mulder, WBZ News.
Now, WBZ and CBS are partnering with the National Alliance on Mental Illness this month. So if you or someone you know needs help addressing mental health, you can reach out to the Alliance. Online, the Massachusetts chapter is namimass.org. You can also call them. That's 617-580-8541.